Removing caries, step-by-step dental procedure. Dental caries, also known as cavities or tooth decay, is one of the most common oral health problems affecting people in the United States and Canada. This video will guide you through the entire caries removal process using advanced 3D animation, so you know exactly what to expect during a dental visit. Caries begins when bacteria in dental plaque produce acids that gradually erode the enamel, forming small holes in the tooth. If left untreated, this decay can spread deeper, causing pain, infection, and even tooth loss. Early detection and treatment are essential for maintaining long-term oral health. The caries removal procedure starts with a thorough dental examination. Your dentist will visually inspect your teeth and may use dental x-rays to determine the extent of the decay. Local anesthesia is typically administered to numb the area and ensure a pain-free experience. Once the tooth is numb, the dentist uses a high-speed dental drill, or in some cases, a dental laser, to remove the decayed portion of the tooth. The goal is to eliminate all infected tissue while preserving as much healthy tooth structure as possible. The cavity is then shaped and cleaned to prepare it for the filling material. There are several options for filling materials, including composite resin, amalgam, ceramic, and gold. Composite resin fillings are popular for their natural appearance and are often used for front teeth. Amalgam fillings are durable and commonly used for back teeth where chewing pressure is greatest. Your dentist will discuss the best option based on the location and size of the cavity. After selecting the filling material, the dentist carefully places it into the prepared cavity. Composite fillings are applied in layers, with each layer hardened using a special curing light. The filling is then shaped and polished to match the natural contours of your tooth, restoring both function and appearance. In cases where the cavity is large or the tooth is severely weakened, a dental crown may be recommended instead of a simple filling. If the decay has reached the pulp, root canal therapy may be necessary before the tooth is restored. The entire caries removal and filling process usually takes between 30 and 60 minutes, depending on the complexity of the case. Most patients experience little to no discomfort during or after the procedure. Preventing caries is the best way to avoid dental treatments. Brush your teeth twice daily with fluoride toothpaste. Floss every day, limit sugary foods and drinks, and schedule regular dental checkups. Early detection allows for simpler and less invasive treatment. If you notice tooth sensitivity, pain, or visible holes in your teeth, contact your dentist as soon as possible. Prompt treatment of dental caries can help you maintain a healthy, confident smile.
Dental caries, also known as tooth decay or cavities, is one of the most common dental problems worldwide. It affects people of all ages and can lead to tooth pain, infection, and even tooth loss if left untreated. Understanding what caries is, how it develops, and the best ways to treat and prevent it is crucial for maintaining healthy teeth and a confident smile. What exactly is dental caries? Caries is a process where the hard surface of your teeth, called enamel, is gradually destroyed by acids produced by bacteria in the mouth. These bacteria feed on sugars and starches from the food and drinks we consume. As they break down these carbohydrates, they produce acids that attack the enamel, leading to demineralization and the formation of tiny holes. Over time, these holes can grow larger, reaching the deeper layers of the tooth, causing pain and sensitivity. The process of tooth decay usually starts with the formation of dental plaque, a sticky film of bacteria that constantly forms on teeth. If plaque is not removed regularly through brushing or flossing, it hardens into tartar, which can only be removed by a dentist. The bacteria in plaque and tartar continue to produce acids, creating an environment that promotes further decay. There are several stages of caries development. In the earliest stage, you might notice white spots on your teeth, which indicate the loss of minerals. At this point, the process is still reversible with good oral hygiene and fluoride use. As the decay progresses, the enamel breaks down, forming a cavity. If left untreated, the decay can reach the dentin, the softer layer beneath the enamel, causing increased tooth sensitivity, especially to hot, cold, or sweet foods. In advanced cases, the decay reaches the pulp, the innermost part of the tooth containing nerves and blood vessels. This can lead to severe tooth pain, infection, and abscess formation. Recognizing the symptoms of caries early is essential. Common signs include toothache, sensitivity to temperature or sweets, visible holes or pits in teeth, brown or black staining, and bad breath. If you experience persistent tooth pain or swelling, it is important to seek dental care as soon as possible. So, how is dental caries treated? The approach depends on the severity of the decay. In the early stages, fluoride treatments can help remineralize the enamel and reverse the damage. Fluoride can be applied as a varnish, gel, or foam by your dentist, or you can use fluoride toothpaste and mouthwash at home. For small cavities, the most common treatment is a dental filling. The dentist removes the decayed portion of the tooth and fills it with a material such as composite resin, amalgam, or ceramic. If the decay has reached the dentin or pulp, more extensive treatment may be needed. A root canal is performed when the infection has spread to the pulp. During this procedure, the dentist removes the infected tissue, cleans the inside of the tooth, and seals it to prevent further infection. In cases where the tooth is severely damaged and cannot be saved, extraction may be necessary. The missing tooth can then be replaced with a dental implant, bridge, or denture. Preventing dental caries is always better than treating it. Good oral hygiene is the most effective way to keep your teeth healthy. Brush your teeth twice a day with fluoride toothpaste, making sure to reach all surfaces, including the gum line and the back teeth. Floss daily to remove plaque and food particles from between your teeth where your toothbrush cannot reach. Using an antimicrobial mouthwash can further reduce bacteria and freshen your breath. Diet also plays a significant role in cavity prevention. Limit your intake of sugary and acidic foods and drinks, such as candies, sodas, and fruit juices. These can accelerate the decay process by providing more fuel for bacteria. Instead, choose a balanced diet rich in fruits, vegetables, whole grains, and lean proteins. Drinking plenty of water, especially fluoridated water, helps wash away food particles and neutralize acids. Regular dental checkups are essential for early detection and management of caries. Dentists can spot early signs of decay that you might not notice and provide professional cleanings to remove tartar buildup. Dental sealants are another preventative measure, especially for children and teenagers. Sealants are thin coatings applied to the chewing surfaces of back teeth to protect them from decay. If you experience tooth pain, sensitivity, or notice any changes in your teeth, do not delay seeking professional help. Early intervention can save your tooth and prevent complications. Remember, dental caries is a preventable disease. By practicing good oral hygiene, making smart dietary choices, and visiting your dentist regularly, you can maintain healthy teeth and enjoy a lifetime of healthy teeth. If you already have cavities, effective treatments are available to restore your teeth and relieve pain. Take charge of your oral health today and protect your smile for the future. Subscribe to the channel, leave a comment, and hit like. This channel is all about teeth, dental health, and oral care. This is educational content only. If you experience any symptoms or concerns, please consult a dentist immediately. Dental Vision 3D Animation.
Why you grind your teeth at night? Bruxism explained in 3D animation. Do you wake up with jaw pain or headaches? You might be grinding your teeth at night without even knowing it. This condition is called bruxism, and it affects millions worldwide. Our 3D animation shows what really happens. Your jaw muscles contract with surprising force, up to 250 pounds per square inch, wearing down your enamel and causing real damage. Bruxism usually strikes during deep sleep, triggered by stress, anxiety, or sleep disorders. Over time, it can lead to cracked teeth, TM chip problems, and chronic headaches. The good news? Bruxism is treatable. Night guards, stress management, and better sleep habits can protect your teeth and relieve pain. If you notice these symptoms, talk to your dentist. Don't forget to subscribe to Dental Vision 3D Animation for more life-changing medical animations. Your health matters.
Dental implant essentials. Dental implants are the leading solution for tooth replacement in the United States. with over 3 million Americans already benefiting from this technology. Each year, more than 500,000 new dental implants are placed across the country. If you are missing one or more teeth, understanding how dental implants work can help you make the best decision for your oral health. A dental implant consists of a small titanium post that is surgically placed into the jawbone, acting as an artificial tooth root. Over several months, the implant fuses naturally with the bone in a process known as osseointegration, creating a stable foundation for a replacement tooth. Once healed, a custom-made crown is attached to the implant, restoring the look and function of your natural tooth. Implants offer several advantages over traditional bridges and dentures. They help preserve jawbone structure, maintain facial appearance, and prevent neighboring teeth from shifting. Dental implants restore nearly all of your chewing ability, allowing you to eat your favorite foods with confidence. In the United States, dental implants have a success rate of over 95%. When placed by experienced professionals, most dental insurance plans now offer partial coverage, and many dental practices in the US provide flexible payment options to make treatment accessible. Ideal candidates for dental implants have healthy gums, sufficient bone density, and good oral hygiene. Even if you have certain health conditions, such as diabetes, you may still qualify for implants with proper management. The cost of a single dental implant in the US typically ranges from $3,000 to $6,000, depending on the complexity of the case and your location. While the initial investment may be higher than other options, dental implants are designed to last for decades, making them a cost-effective long-term solution. Recovery after implant surgery is usually straightforward, with most patients returning to normal activities within a few days. Good oral hygiene and regular dental checkups are essential for long-term success. If you are considering dental implants, schedule a consultation with a qualified implant specialist in your area. Dental implants can restore your smile, confidence, and quality of life for years to come. For more 3D dental animations and expert oral health information, subscribe to Dental Vision 3D Animation.
Can caries cause bad breath? Why can the mouth smell? Dental caries, also known as cavities, can absolutely cause bad breath. Cavities form when bacteria in the mouth break down sugars and produce acids that damage tooth enamel. As the tooth decays, it creates small holes where bacteria and food particles can get trapped. These trapped bacteria release sulfur compounds and other substances that produce a strong, unpleasant odor. However, cavities are not the only reason your mouth might smell bad. Poor oral hygiene is the most common cause of bad breath. When you do not brush and floss regularly, food debris stays in your mouth, feeding bacteria that produce foul-smelling gases. Gum disease, or infection of the tissues around the teeth, is another major cause. Bacteria in infected gums can create toxins and odors that are difficult to remove without professional care. Dry mouth can also lead to bad breath because saliva helps wash away food particles and bacteria. Without enough saliva, odor-causing substances stay in the mouth longer. Other factors include a coated tongue, which can harbor bacteria, certain foods like garlic and onions, smoking, and some medical conditions such as diabetes or throat infections. The good news is that most cases of bad breath can be prevented. Brushing twice a day, flossing daily, cleaning your tongue, drinking plenty of water, and visiting your dentist regularly can all help keep your mouth healthy and your breath fresh. If you notice persistent bad breath even with good oral hygiene, it is important to see a dentist or doctor to check for underlying health issues. Science made simple for everyone, everywhere. Like if you learned something new about your mouth. Subscribe for more dental health secrets. Comment, what's your biggest breath concern? Share to help friends with fresher breath.
.3D chemical cleaning of dental plaque. Welcome to Dental Vision 3D Animation. In this video, you'll see how dental professionals in the United States remove plaque and tartar using advanced chemical cleaning techniques, and why these procedures are essential for maintaining oral health. Plaque is a sticky film of bacteria that forms on your teeth within hours after eating or drinking. If not removed by daily brushing and flossing, plaque hardens into tartar, also known as calculus. Tartar cannot be removed at home and requires professional intervention in a dental office. In the United States, dental hygienists and dentists begin the cleaning process by thoroughly examining your teeth and gums. The first step is scaling, which involves the use of ultrasonic instruments that vibrate at high frequencies. These devices break apart and remove tartar deposits from above and below the gum line. Water is sprayed continuously during this process to wash away debris and keep the area clean. Chemical cleaning agents are then applied to target bacteria and help prevent future plaque buildup. The most common chemical used in American dental offices is chlorhexidine, an antimicrobial solution that penetrates the biofilm and disrupts bacterial colonies. Dentists may also use hydrogen peroxide or fluoride-based gels to further clean and strengthen the teeth. For patients with gum disease or deep pockets around the teeth, a procedure called scaling and root planing is performed. This deep cleaning goes beneath the gum line, and chemical irrigants are used to flush out bacteria and toxins from these hard-to-reach areas. These solutions help reduce inflammation and promote healing of the gum tissue. After the chemical treatment, a polishing compound containing mild abrasives and fluoride is applied to the surface of the teeth. This step removes surface stains and smooths the enamel, making it more difficult for plaque to adhere in the future. The fluoride also helps to remineralize and protect the tooth enamel. The American Dental Association recommends professional cleanings every 6 months for most people in the United States. Regular chemical cleanings, combined with daily brushing and flossing at home, are the most effective way to prevent cavities, gum disease, and tooth loss. New technologies are emerging in American dentistry, including plasma jet devices and advanced antimicrobial rinses, which promise even more effective and comfortable plaque removal in the future. If you want to protect your smile and avoid more serious dental problems, schedule regular cleanings with your dentist or dental hygienist. Professional chemical cleaning is a cornerstone of modern American dental care and plays a vital role in keeping your teeth and gums healthy for life. For more 3D visualizations and clear explanations of dental procedures, subscribe to Dental Vision 3D Animation. Stay informed and take charge of your oral health with the latest insights from leading dental professionals in the USA and Canada.